Welcome to Love and Abuse, the show about helping you identify poisonous communication and toxic behavior. You deserve to be treated with respect and kindness. That's why it's important that you learn to pinpoint manipulative and controlling behavior so that you keep your power and your sanity. I'm your host, Paul Coliani. Welcome to another episode of Love and Abuse. If this is your first time, then welcome to the show. And if you've been listening a while, I'm glad you're back. Just remember, all the information on this show is meant for educational purposes only. Always seek a professional for your mental health and well-being. And always pick your battles wisely. I don't know if you know anyone that you have to pick your battles with. I've known people like that. And it's just not worth it. It's just not worth getting into some conversations with certain people about certain things. You have to converse with certain people sometimes, but you know that subject matter that you can't get into because it'll just end badly. But that's why I create this show. I want to foster and help nurture healthy communication and help you make the healthiest relationship you can make. If you have a healthy relationship, then you can speak your mind, be expressive, be honest, and the repercussions of that won't be disastrous. I think that is a sign of a healthy relationship, is when you can speak your mind and the repercussions aren't disastrous. That could look like a lot of things, I know, but I think you know what I mean. When you're in a relationship that you can have honest conversation where you can express yourself and it doesn't end up as a disaster, it's very similar to what doesn't kill you makes you stronger. The only reason I say that is because in my experience, when you're honest and you are expressing the hard truths to another person and they're expressing them to you, even though they may be hard to hear, they almost always strengthen the bond. That has been my experience over and over again, personally, as I've done this in my past and with other people I've known, and I teach over in the Healed Being program as well for emotionally abusive people that want to change. I teach them it's time to be honest. It's time to be forthcoming with what's really going on inside of you. What's really down there, what's deep inside that causes you to be hurtful instead of honest. And so they try some things that I suggest to them, and suddenly the other person is opening up to them, is feeling more connected to them. This is typically what happens, is when you hide what you really feel behind hurtful behavior, what ends up happening is that the relationship tends to dissolve. There's a wedge that's driven between the two people. And when that happens, of course, it only gets worse unless healthy communication starts to happen. So when you have healthy communication, you're being honest, you're being expressive, you're sharing the deep stuff that might hurt the other person, and not in an intentional way, but it might be hard for the other person to hear. It might be hard to hear a truth. When you are able to survive those times, those truths, the relationship usually gets stronger. Not always, but most of the time, most healthy relationships can handle most truths because the people want to be in the relationship. I mean, when you have two people that want to be in a relationship, no matter what kind of relationship it is, when you have two people that want to be around each other, that want to talk to each other, or in a romantic way, they want to live together, they want to be together, then you have effort on both sides. You are moving toward each other, and you want to continue moving toward each other or be with each other in some way where you're connected. So when you have effort on both sides, somebody can say something that will be hard to hear, but you survive it, you make it through it. And it typically makes the relationship stronger. So when the relationship is stronger, that means the bond is stronger. That means you feel connected. You feel more secure in the relationship, even though a hard truth was shared. And I'm not saying every hard truth is like this. Some hard truths are too hard. Some hard truths are too hard to share. Now, I know the majority of people that listen to the show are in some type of relationship where there is toxic communication, and typically one person being more toxic than the other, or one person being toxic and the other person is not toxic at all. They're just taking the hurtful behavior. And because the majority of people that listen to this show are in a certain type of toxic relationship, then the comment that both people are working toward each other and making an effort to build the relationship, make it stronger, that comment doesn't really apply, because one person is usually trying to control or change the relationship while the other person is trying to comply with the person trying to control or change the relationship. And comply is really the wrong word. They're just trying to make the relationship well again. And sometimes they're trying to satisfy the other person, which is why I said comply. It's like they're trying to comply with the other person's wishes or needs or wants. And no matter what they do, it's just never enough. So that type of relationship isn't necessarily two people working toward making the relationship great. It's one person trying to control the relationship, and the other person doing what they can to satisfy the needs of the controlling person. Again, that's a very simplified way to look at it, but I know there's a lot of people listening now that are in that situation. So as I talk about fostering healthy communication, in a toxic relationship, it doesn't work. You can try to foster healthy communication all day long, but in the toxic relationship, you can't do it because there's no effort coming from the toxic person. They just want to make things the way they want. And so the victim of that scenario is trying to make things copacetic, trying to balance things out, trying to make the relationship nice and manageable, but the other person just wants what they want, and they're trying to make the situation exactly the way they want it. And again, I'm simplifying some things here, but I'm just letting you know that I understand that if you're in a toxic situation, it's very difficult to foster healthy communication. But this is why I do this show, and this is why I read messages from people and try to help you through these situations like I'm about to do now. This is my segue. I'm going to move into an email that somebody sent me, and I'm going to see what I can do to help them through the situation they're in. Let me pull it up here. This person wrote, "Hey, the Love and Abuse podcast is really great in helping me through a breakup. Your show got me thinking, what advice or insight would you give someone if their partner is using their own depression as a tool to control the relationship or manipulate the other person? My partner was depressed because of a mistake they made, for example, cheating. I'm no longer in the relationship. I discovered my partner cheated after the relationship ended. I now look back knowing it caused havoc on the relationship, and she admitted to certain things, and I watched it cause many problems. Having had time to process things, the gaslighting and control was more evident than ever. It would be great to get your thoughts on this. Can a person unintentionally become a manipulator? Even still, is that fair on the other person?" Okay, thanks for sharing that. And I think you have a couple questions here. And let me just explain, just in case it didn't come across well when I read it here. This person, your partner, your ex-partner, said they made a mistake and they cheated, and you didn't know it at the time, and they became depressed because they realized it was a mistake, but they used that depression as a tool to control the relationship or manipulate the other person. So what I'm gathering here, what I'm interpreting, is that let's just say it was a woman. She was depressed, and she was using that depression as a way to control or manipulate you. Let's talk about that first. I think that's entirely possible, and I think a lot of people do that. In fact, if you've ever heard me talk about secondary gain, there can be a gain that comes from something that you don't like, meaning I don't like being depressed, but I could gain something from it, and that's called secondary gain. So I might gain attention and support, maybe doting, maybe being served, waited on, because I'm depressed, because the other person feels bad for me. And that could be a way that I manipulate the situation. I coerce you into doing things for me because I know you feel bad that I'm depressed. If you feel bad that I'm depressed, you might do things in a way that satisfy me, even though I don't like being depressed. But if I choose to work on that or go to therapy or try to heal from that depression, I might either consciously or unconsciously realize that I lose your support and your attention that I only get because I'm depressed. I hope that came out the way I wanted, but I think you understand is that if a person is depressed, they could use that depression to get a gain. Again, it's called secondary gain. So there's a gain to something that they have that they may feel victim to, like depression, but there's a benefit to being a victim to what they have or what they're going through. That's tough. I mean, because people can use that indefinitely. I'll just use depression as an example here. Someone can stay depressed indefinitely throughout a relationship because they keep getting a benefit by staying depressed. So if they are healed, what kind of attention would they get then if they're seeking attention, for example? Would they get their breakfast, lunch, and dinner served to them in bed? I'll go extreme here. Would they get that if they weren't depressed anymore? Probably not. Because the other person now sees them as more of an equal, not unhealthy, not unwell, not sick, not depressed. And now the other person is expecting the formerly depressed person to show up in a way that is more equal, more independent, more able to take care of themselves. And what that does is let the other person off the hook. Like, I don't have to wait on you hand and foot anymore. Not that they didn't mind doing that. Maybe they were okay doing that. Maybe they wanted to continue serving that person because they cared about that person being ill, but they also have a life too, and they want to live that life, and they want to have their own time to themselves. They want to have me time. So when the other person stops being depressed, it gives them their me time back. But the person who was using their depression or whatever they were going through as a means to get a benefit, what is their incentive for stopping being depressed? This is very similar to something like the silent treatment. The silent treatment, when it's used to guilt someone, when it's used to withhold love and attention and so forth, when the silent treatment is used in that way, there's a secondary gain to it. So the person in silent treatment might feel like a temporary depression or just mopey and sad, and the other person that is watching this silent treatment and a recipient of the silent treatment might do everything they can to help them snap out of it. And when the person doesn't snap out of it, what is the person who's doing the silent treatment, what is their secondary gain? And I'm only talking about silent treatment that is purposely done to make someone feel guilty, withhold love, withhold support. I'm only talking about that type of silent treatment. I'm not talking about the type of silent treatment where you need time to process things and you just want to get away from the other person for a while so you can process stuff. That's not intentionally making someone feel bad. That's just the time you need to process. The silent treatment I'm talking about is, yes, it's trying to make the other person feel guilty. It's trying to make the other person feel bad so that the other person will do behavior or say things that help the person doing the silent treatment achieve some objective. That sounds so logistical, I'm sorry, but it really does come down to that. When someone gives the silent treatment for the purpose of guilting or withholding love and support, there's an objective behind it. There's a reason behind it, because I guarantee you they're not going to do the silent treatment if you're not in the room. The silent treatment used for guilt and coercion like this isn't used when you're not in the room. Silent treatment requires another person, and that other person has to be witness to that silent treatment. so that there can be a gain that's accomplished from that person being silent. What is the gain? The gain is whatever the person doing the silent treatment wants the other person to do. And instead of being direct, hey, will you do this? They use silence. It's a covert form of emotional abuse. It's not a direct request. It's not a conversation with hard truths where you want someone that you care about to do something for you or do something different. So the person hides behind silence. They hide behind manipulation, and they state things in a way that are very covert, very under the radar. And so coming back to what this person is asking, can a person use depression as a tool for manipulation, as a tool to get what they want? I hope I answer your question. Yes, absolutely. And it's important that if you are on the other side of this, if you are the person being manipulated, being coerced with something like that, that you have to start thinking about changing the way you respond to certain things. If someone is depressed and they're using it as a tool to manipulate you, I think you have to separate the depression from the manipulation. In other words, if she's in depression and she needs help or medication or therapy or whatever she needs, that is a separate issue that perhaps you could look into together. But if her depression is used for secondary gain to try to control you, to get her wants and needs met regardless of how you feel, if I were in your shoes, this is what I would do. I'm not necessarily suggesting that you do this if you're in this situation, but this is what I would do. If my girlfriend started doing this, I would treat it very much the same way, and this is going to be extreme, but very much the same way as if she threatened to kill herself if I left. There's an episode I did over at loveandabuse.com called If You Leave Me, I'll Kill Myself, the ultimate abuse of your empathy and compassion, when they threaten to kill themselves. And when they do that, you have to treat that comment as 100% truth. That's my take on anyone that threatens suicide if you want to leave them or, do something that they don't like. If they threaten suicide, I believe you have to treat it as 100% truth. And if you were to believe them 100%, what would you do? If it were me, I'm calling the police. I'm calling 911. And I'm going to ask them, what do I do? My friend here or my girlfriend just said she's going to commit suicide. I need help. What do I do? That's what I would do. I can't tell you that's a good thing to do for you or not in any situation, because I could steer you one way and it could go badly. I could steer you another way and it could go badly. I could give you the exact thing to do and say in that situation and it could still go badly. But I know what I would do. I would treat a threat like that with 100% certainty they were going to do it. It does two things. What it does is, one, the person who, for example, threatens suicide, you are hopefully going to save their life because you're calling someone that can maybe handle this better. And two, it's accountability if they're lying. If suddenly the police show up or a psychiatric team shows up or whoever you call, like their suicide hotline is a good number to call as well. If somebody shows up, they're going to realize, oh, so when I use that threat and I'm not truthful about it, there's accountability for that. I'm going to have to continue this lie with these people that showed up. And if I do that, I might end up in the psychiatric ward. I don't know, so maybe I shouldn't do that anymore. That's what I would do if someone I cared about threatened suicide and I wasn't sure if they were lying or not. I absolutely believed them. I make it true in my mind so that I would do the things that I would do if I knew 100% it was true. With depression, it's the same thing. If somebody was depressed, I would do everything I can to help them. I would say, okay, we need to talk to a therapist. Maybe they can get you some medication, but we need to go through with that because you can't stay depressed. That's not a good state to be in. And I want to help you through this because I love you. And I want to help you out of it because I love you. But if they refused therapy, if they said, no, I don't want to do that, it's not going to work, and if they were giving me every excuse to not get better in their depression, then I would tend not to believe that they're depressed. Not saying that someone who's depressed wouldn't do that. There are times when people are depressed where they don't want therapy, and that's, their choice. But in this case where I'm feeling like my life is being drained as well along with them, and I can't do the normal things that I would normally do, and I constantly feel myself being dragged down with them and pulled into whatever they have going on, and I can't pull myself out, and they won't let me live my life the way I want. If my girlfriend was doing this, I would, be honest with her. Hey, look, I have stuff to do. I have to go to work. I have to do these things, and I'm going to do my best to take care of you, but I still need to get this done. And if she kept dragging me in because there was some sort of coercion or manipulation, I know it's sometimes hard to tell, but if I kept feeling myself continually manipulated in some way, and I would have to, look at all the facts, but if I kept feeling like that was happening, then I would have to start treating the depression as something that probably won't go away and I need to treat seriously, which means I need to get her into therapy. That would be my path, because I wouldn't want us both to be depressed. I wouldn't want us both to go down that road. And if there is manipulation and coercion going on, and I sensed it, then I would definitely want to get her help as soon as possible, because of the same things I just talked about on somebody who threatens suicide if you want to leave them or break up or whatever. If they realize that you're serious about getting them help, then what ends up happening is they either stop being depressed magically, or they get the help. And either way is a benefit. And again, I'm not giving you this advice. I'm telling you what I would do, because this is a very tricky area with depression, with threats of suicide. Very tricky area, because you don't know what's going to happen. You don't know what's going to push them over the edge. You don't know if they're serious. And of course, you probably love them. You care about them. And if they're being manipulative, they're going to use that fact that you care about them against you. They're going to use it to control you. But if they really are depressed, then treating it seriously still helps them. And if they aren't depressed and they're using that, then you show them that you're privy to their game, and they may just stop being depressed because they don't want to have to go through therapy and go through all these steps, because all they really wanted to use it for was to manipulate you. So that's a very unique case. I hope everyone listening now doesn't have to go through that, or hasn't had to go through that in the past. But that's my thought regarding this person who wrote. And he also said, can a person unintentionally become a manipulator? Well, this is where the secondary gain thing comes in. Sometimes you can have a secondary gain, a benefit for a condition that you have that you don't necessarily want to have, and not even realize you're getting a benefit from it, because it could be very much under the radar, meaning it's not overt. So let's just say someone's depressed and they're getting all this love and attention, and they don't realize that their depression is what's getting them the love and attention. But maybe subconsciously they realize that on the days they feel better, they don't get as much love and attention, or they don't get the same type of love and attention. So unconsciously it starts to reprogram or repattern their state of mind and their depressed states, their feelings on a daily basis, and it becomes a reconditioning, and their reconditioned state starts to side or lean toward being depressed more often than not, which absolutely could be an unconscious thing. So can a person unintentionally become manipulative? Yes, I think it's very possible, and it happens probably quite a bit, because let's just say, using your example of depression, let's just say that somebody gets depressed and they didn't intend to manipulate, but while they were depressed, they realized they're getting a lot more attention. They didn't really think about it. They just thought people were caring about them because they're depressed. but they don't realize the benefit they're getting from being depressed. And so what ends up happening is they try to get better because they don't want to stay depressed. And as they try to get better, they notice the changes. They notice less love and attention, and they may not make the connection between being treated differently and healing. So what ends up happening maybe is that as they heal and feel better and they get less love and attention, they may get depressed because they have less love and attention. They may start feeling bad because all the attention they received before was fulfilling in some way. But when that love and attention disappears, suddenly they go back to feeling depressed or down. And when they see other people leaving them alone a little bit more because they're feeling better, they may not make that connection that their depression is coming back because of their own thought process of people not paying attention to them. And so what they're doing is attributing their down state, their depressed state, to people not loving and caring for them. And so when they are starting to come out of depression, it seems that people are caring about them and loving them less, even though it's probably not true. They go back into depression. So I believe that can happen. Absolutely. And that's tough, because if you're in that situation with somebody who's depressed, what do you do? And I think it's important to express yourself. Hey, look, I want to help you through this. Let's find a solution. As I've said before in past episodes, in a romantic relationship, or most relationships, you can't be the other person's coach or therapist, especially when it's a deeper issue. It's almost impossible to be someone else's coach or therapist when you are so close to them, because you're in the equation. Without you, they act differently. With you, they act this way, and this way could be damaging to the relationship. But because you are not a third-party observer and you can't be unbiased, you are part of what's going on, I highly recommend that you are not the sole therapist, coach, or the person that is supposed to help someone's mental or emotional state. That doesn't mean you can't hug someone when they feel like being hugged. That doesn't mean you don't share wonderful experiences. I'm talking about conditions that often require psychiatry, talk therapy, coaching, or whatever. It's very, very difficult for someone you are close to, when you are a variable in the equation of their condition, to be able to help them, because you are part of it. And sometimes the only way to help someone like that is to see the whole equation from outside, from a third-party perspective. So that would require somebody that's not included in the equation of what's going on, in the cycle of what's happening, to look at all the variables in the equation and figure out where the problem areas are, where the challenges are. And it's very difficult to do that when you are one of those variables. So to have someone look at it objectively from outside and see what's happening, see what you're doing, see what they're doing, hear what you're saying, hear what they're saying, all of that requires typically a third-party perspective. And the reason I say that is because if you are in a situation like this person was, where his partner was really depressed and he felt like he needed to be the one to help her through it, you can be there as a support system, but it's very difficult to be there as a therapist or a coach, like I was saying. And if he was trying to show up that way, then he probably felt himself become more and more drained and more manipulated, because maybe she wasn't seeking outside help, maybe she wasn't seeking therapy, or if required, medication, and that caused a big drain on him. So this is a very tricky subject to talk about, and I hope that I was able to convey my insights and opinions on this that made it helpful to the person who wrote, or anyone listening that needed to hear this today. Thanks so much for tuning in. Share this with others that might benefit. Love and Abuse is the official podcast of the Mean Workbook, an assessment and healing guide for difficult relationships. You can download the workbook today to help you determine if you're in an emotionally abusive relationship. It'll give you the tools to pinpoint the specific unhealthy behaviors causing you to leave so many interactions feeling bad. If you're in a difficult relationship and you want to know what your next step should be, the assessment and the workbook will help you make decisions that are right for you. Visit loveandabuse.com for more information. If you've discovered that you are doing emotionally abusive behavior and you'd like to change that about yourself, sign up for the Healed Being program over at healedbeing.com. This show exists to remind you that you are not alone and you're not going crazy. You deserve to be treated with respect and kindness. You deserve honesty and sincerity. You deserve to be treated as worthy and significant. Because you are. Thanks for joining me today. We'll talk again soon.